The first sort of myth I'd love you to dispel is that just because you already have a plan doesn't mean you should simply re-up because plans change all the time.
That's right. That is, I think, one of the biggest mistakes I see people make is that they think, well, I've been happy with the plan this year. I'm not going to do anything. I'll just let myself be sort of automatically renewed into the plan for the next year. And unfortunately, that often it can come back to bite you because plans change. Not only do premiums change, but benefits can change, cost sharing can change. And so it really is important, even if your own circumstances haven't changed, to just go in and check and make sure that what you need covered is still covered and that the costs haven't changed dramatically.
Hey everyone, I'm Jean Chatsky. Thank you so much for joining me today on Her Money. It's that time of year again. Yep. Spooky season. It's pumpkin spice latte season. I gotta admit, I don't think I've ever had a pumpkin spice latte. I've had pumpkin spiced Special K and Cheerios because of the pumpkin spice creep that has become an important part of our October economy, but never a latte. I'm going to have to work on that. But it's also, and this is the point of today's show, it's also open enrollment season. And granted, this might be the less fun part of autumn, but it's absolutely essential from a financial point of view that we do a thorough review of all of our benefits options, and in particular, our health insurance options to make sure that we are choosing the best health plan for us without paying more than is necessary. Unfortunately, choosing the plan with the most coverage that's also the most cost effective for you and your family, if you're covering a family, is also not easy. According to 2023 research from JAMA Health, almost half of U.S. consumers say they do not understand some aspect of their health insurance coverage. One third do not understand exactly what their plan covers or what they might owe out of pocket. And a 2023 Kaiser Family Foundation Health Survey found a majority of adults have experienced a problem using their health plan in the last year, including denied claims, provider network problems, or pre-authorization problems. All just add up to a big headache. In other words, it's not you. The entire system is incredibly difficult to navigate, but the more knowledgeable we can become about our health plans, the better the choices become that we can make about our health, which is arguably one of the most important things in our lives. So today, we're going to unpack all of this. We're going to talk about all things health insurance coverage and choices, and we're going to do it with the help of Sabrina Corlette. She's a research professor, founder, and co-director of the Center on Health Insurance Reforms at Georgetown University. Sabrina, thanks for being here. Thanks for being willing to dive into all of this with us.
Thank you for having me. It's a pleasure to be here.
I gotta say, I'm wondering if people call on you regularly to be sort of a translator of this complicated world that you live in.
Yeah, I do get called on a lot to help people figure out their health plan choices, or unfortunately, and you noted this in your intro, I often get calls when people are getting bills they don't understand, or there's services they got that their insurance plan's not paying for. So helping folks untangle that becomes fairly common part of my day, unfortunately.
Let's start because we are on the precipice of open enrollment. Let's start with what's new, right? We are going into this marketplace for 2025. These are the plans that will cover us for the next calendar year in many cases. Are there any changes that you've seen that might trip people up?
Well, Just like inflation has been hitting our groceries, it's also hitting our healthcare. So the biggest issue that I'm seeing this year are in many cases some pretty hefty premium increases. Now, the good news is for folks who are signed up for coverage through the Affordable Care Act or Obamacare marketplaces, most folks there are insulated from premium increases because of the premium tax credits. And for people with employer-based coverage, thanks to a fairly tight labor market, I think many employers may eat some of those costs and not necessarily pass them on to workers. But a number of employers are likely to pass on some of those premium increases to workers. The other big thing I'm seeing this year for employers is decisions about whether and how to cover GLP-1 drugs. These are your Ozempics, your Wegovy's. These are these miracle weight loss drugs that I'm sure many of your listeners have heard about. And unfortunately, not only are they expensive, but people need to be on them for a long-term period. And so employers are really wrestling with whether to cover them. And if they do cover them, whether they're going to make people jump through a bunch of hoops and hurdles to get them.
It's such an interesting part of the marketplace these days, the GLP-1s, because it's not only that we are seeing advantages to people who want to use them to weight loss, but they're starting to show all sorts of advantages for impulse control. I have a nephew who's pretty severely along the autism spectrum, and he was prescribed one for weight, but it has really improved his impulsivity to a great degree.
Yeah, there's a lot we don't yet know about these drugs, but I think one of the issues for employers and also, frankly, for the government in Medicare and Medicaid and other government health programs is as we're getting this evidence of how effective these drugs are, not just for weight loss, but for other health conditions as well. How do we balance that with the fact that they are expensive and they are a drug that people need to stay on? It's not like you can just be on it for a month and then it's done. So it presents some really big cost challenges that we have to wrestle with.
So let's start at the top and break down the process of actually shopping for a plan. The first sort of myth I'd love you to dispel is that just because you already have a plan doesn't mean you should simply re-up, because plans change all the time.
That's right. And that is, I think, one of the biggest mistakes I see people make is that they think, well, I've been happy with the plan this year. I'm not going to do anything. I'll just let myself be sort of automatically renewed into the plan for the next year. And unfortunately, that is often, it can come back to bite you because, as you said, plans change. Not only do premiums change, but benefits can change, cost sharing can change. And so it really is important, even if your own circumstances haven't changed, to just go in and check and make sure that what you need covered is still covered and that the costs haven't changed dramatically.
And when you talk about what you need covered still being covered, you're talking about the prescriptions you take, right? Because formularies change from year to year, the list of drugs that plans are willing to cover, and doctors move in and out of plans or in and out of accepting different plans. How often does that happen?
Oh, it happens all the time. And in fact, and I think this is something folks should know, is it doesn't always necessarily happen on a calendar year basis. So your health plan could drop the drug that you're taking from its formulary at any point during the year in most states. It can also drop the doctor that you rely on at any point during the year. So yes, you should check those things before you enroll during open enrollment season, but you shouldn't necessarily assume that it will be the same throughout the whole year.
What can you do if some mid-year change like that affects you and you're on an employer plan or an Obamacare plan that you signed up for the year?
Right. So one of the first things I advise people to do before they head to the doctor or before they head to a facility if they're getting a procedure is not only check with your plan to make sure that the provider is in network, but also, unfortunately, you also should call the provider because quite often the plan's information is not up to date. So it's a lot of administrative work for folks, but it can pay off in the end just to really make sure that those providers are still in your plan network.
Okay, so we've taken a look at our plan from last year. How do we then go about the process of evaluating whether there's a better choice for us? Is there a step-by-step process that you think people should go through?
Well, it's hard to have sort of a generic template that everybody should use because healthcare is a very personal thing and it depends not only on your own health status, but it also depends on your financial situation, your tolerance for risk, and whether there are other people that might be on your plan with you, a spouse, some children. So it's a complicated set of decisions, but generally what I advise folks to do is you start with the premium. That's coming out of your paycheck every month, no matter what. So make sure it's a price that you can afford. The other thing to look at is what we call the MOOP in health insurance terms, but it's the maximum out of pocket amount that you would have to pay out of your own pocket before the health plan's coverage kicks in full. And that just helps you understand like worst case scenario, right? I get a terrible cancer diagnosis or somebody in my family has a major trauma or accident. That MOOP, that maximum out of pocket amount tells you, okay, this is what I need to stock away and set aside for a real rainy day. And this is what the plan will cover. And those can be different from plan to plan. So some are very low and some are quite high. Like if it's a family plan, it can be as high as $12,000, $13,000. So that's another thing to look at. And then, of course, as we discussed, you want to just check, are the doctors that we rely on, are those in the network? If there's a drug that you need, is that on the formulary?
You mentioned the cost of your premium, and your premium is the amount that you pay each month for your plan. As you said, it usually comes out of your paycheck if you're on an employer plan. I've seen studies in the past that point to the fact that premiums in and of themselves can be blinding. If you go to the cheapest possible premium, you may end up making up the difference in higher copays, which is the amount that you pay every time you go to the doctor, or higher coinsurance amounts, the percentage that you're asked to pay, or higher prescription drug costs. How do you evaluate if you're better off knowing that you're going to pay for those costs going in premium dollars, or figuring out if you're better off sort of paying on the back end?
Right. So it all sort of hinges on what kind of trade-offs you're willing to live with, right? So typically, a plan with a lower premium is going to come with higher out-of-pocket costs. That might be a deductible. That might be co-payments or other forms of payment that you have to provide when you go to a doctor's office or a pharmacy. It could also be because the plan has what we call a narrow provider network. They constrain the choice of doctors or other providers that you can see. And you might be more than willing to accept that trade-off in exchange for the lower premium. Or you might say, you know what, I really want a broad choice of providers, or I don't want to have to worry about a high deductible. I will pay the higher premium. But these are really personal decisions and often depend on sort of how much you're able to sort of set aside for that rainy day fund if you end up going with a plan that has a high deductible.
Truly high deductible plans, the ones that allow you to open a health savings account, have for years been among the fastest growing plans that we've got in this country. But the New York Times recently did an article. They explored the fact that during open enrollment, people tend to actually keep the older, lower deductible plans that they have rather than go the high deductible route. Who do these high deductible plans benefit most?
Well, quite honestly, they tend to benefit people who are healthier and wealthier. So if you are generally healthy and you don't anticipate needing a lot of healthcare services, then a high deductible plan might be just fine because you never have to worry about facing that deductible. They also, because they are tax advantaged, they do tend to be better for people at the higher end of the income scale. And I think if you know you're the kind of person who would set aside some money each month to put into the HSA, and many people have employers that will contribute to the HSA. If you know you're that kind of person and you'll be disciplined about that, then the high deductible plan with an HSA can be a really good value.
Are you a fan of using the high deductible plan to pay for healthcare costs down the road, for trying to bank the money and pay for your healthcare if you can out of current cash flow and essentially use it as a supplemental retirement account?
Yeah, so in full disclosure, my family, we have a high deductible plan with an HSA, but I will say, like, just a word of caution about that. I was one of those people the New York Times talked about where I was very risk averse. And for a long time, I just paid more to get that low deductible plan. So finally, I was like, I study this stuff for a living. I know what's the right choice. I'm finally going to bite the bullet. We're going to sign up for one of these high deductible plans and the HSA. That very year, at the end of January, my husband had a serious health scare, ended up in the emergency room, a bunch of tests. And literally at the end of January, so within 4 weeks of the start of the plan, we had blown through our deductible and had to pay, I think it was something like $5,000+ out of pocket. And so obviously at that point, we had not had enough time to build up resources in the HSA. That's my cautionary tale. Now, a few years later, it's better, and my husband is healthy and fine, but it was a little bit of a lesson learned, like, make sure you have that money available from day one because anything can happen at any time.
So with a few years in this high deductible account under your belt, how is it actually working for you? I mean, one of the rubs that we hear is that people just don't go to the doctor as much. They have to pay for it themselves, so they will choose to not go, sometimes to their own detriment.
That's true. And the evidence is clear that a lot of people in high deductible plans, not only do they forego care they don't need, they also forego care they do need. So that is a problem with these plans. Now, there is some good news in that all of the plans do have to cover preventive care free without you having to worry about that deductible. So if it's your annual mammogram or a colonoscopy or vaccines for your kids, your annual well visit, all that stuff has to be covered without any cost sharing, whether you're in on a high deductible plan or a low deductible plan.
So a few years in, you're doing okay?
Oh yeah, no, it's working just fine for us. We've been able to build up some money in the HSA, and again, we're very lucky in that we're a relatively healthy family. But I would just say that a high deductible plan and HSA works best if you are relatively healthy and you have that disposable income where you could afford to pay that full deductible if you get hit by an unexpected health event.
We are going to take a very quick break. When we come back, Sabrina, I want to talk about some of the gotchas that people need to watch out for and what to do when you have a health event and you find yourself struggling against your insurer to get your bills actually covered. We'll be right back. We are back with Sabrina Corlette, founder of the Center on Health Insurance Reforms at Georgetown University. All right, so I think we've all heard these horror stories about doctors being out of network or procedures not being covered because of a technicality, or you somehow take yourself to the wrong emergency room. Is there a way that we can prep ourselves for these events in advance?
Boy, that is not always easy to do, but there are some things that I would definitely advise folks to do before they get a healthcare service. One we've already talked about, which is check with your plan, check with your doctor, make sure that they are still in network. The other thing is if you're getting an elective procedure, just check with your plan and make sure that it is something that they will cover. Even if you think it's a fairly routine procedure, that's just a good thing to do. There's also some good news. A few years ago, Congress passed something called the No Surprises Act, which does protect you from unexpected surprise bills in a couple of scenarios. One is if you have a medical emergency and you really don't have a choice of what provider you're going to, you just need to get to the hospital right away, you are protected from out-of-network surprise bills. Your health plan and your provider have to ensure that you only face your standard in-network cost sharing. The other scenario is that if you're in an in-network hospital, may not be an emergency, but you've been smart enough to choose that in-network hospital, but somehow you're treated by an out-of-network doctor. In that circumstance, you're also protected. That's some good news, but there can still be gaps in the system. For example, ground ambulances. If you are taken somewhere in a ground ambulance, you could face some out-of-network surprise bills. So unless you absolutely have to go in an ambulance, I would avoid going to the ER in an ambulance. That's another tip.
One of the surprise bills that my husband and I have encountered in the past couple of years is bills for not quite understanding where our doctor was doing the work. So we both had colonoscopies. We're of that age. We had them by the same doctor. I had mine in one office and he had his in a different office. And his bills were so much higher. Same exact procedure, same amount of time. It had 100% due to the facility. We had no idea of this going in. How do you make sure you know what you're going to be charged for things? And if there are nuances like this that could get in your way?
Yeah, so unfortunately, one thing we've seen in recent years is hospitals are more and more buying up physician practices and other smaller types of providers. And when that happens, hospitals will often tack on to bills something that we call a facility fee. And they claim that they need to charge this facility fee because they have to maintain a 24/7 emergency room and they have all these sort of infrastructure costs. Never mind the fact that the service you're getting is from the same doctor that you've been going to for years, way off the hospital campus. But that is happening more and more. The good news is that a number of states are now requiring hospitals and physicians or anybody who's owned by the hospital to provide notices to consumers before they get the service that they might be charged a facility fee. Some states are actually banning facility fees. But in the meantime, I would say that if you are getting a procedure or going to the doctor, it's probably a good idea just to ask, especially if you know that your doctor's recently been acquired by a local hospital or health system.
How much does shopping around benefit the consumer in a health care marketplace? I mean, whether we're talking about prescriptions, whether we're talking about tests or services, how willing or necessary is it to say, how much does this cost? Can I get it cheaper somewhere else? And I guess how possible is it to get the accurate information?
Unfortunately, at an individual consumer level or patient level, it's really hard to shop around for your healthcare. Oftentimes, things happen to you unexpectedly, right? You just don't have the time to go through every possible provider option in your area to find out what's the better bargain or who might be charging facility fees. Second, even when you can plan in advance, oftentimes it's your doctor that kind of dictates where you go or what service you get and from whom. So it might be the hospital that they are affiliated with or what lab or imaging company they work with. And when you're sitting in your doctor's office and they say, I want to do this procedure at this hospital, it's really hard for patients to push back and say, no, I don't want that hospital. I want a different hospital. I think that's just a lot to expect of people. It's just very, very challenging. And unfortunately, the other thing is we really have very limited tools that people can use to do the kinds of cost comparisons that would allow them to even be savvy shoppers in the first place.
Yeah, there's no car gurus, right? Somebody should build one.
I just think there's such an informational asymmetry between you and your provider that's ordering the service or telling you what you need. It's just hard for consumers. Even when those tools do exist, it's hard to act on them.
You're right. I mean, if my doctor tells me to go to a particular center for my mammogram because they believe in that mammographer, I'm going there, right? I'm not
Yeah.
necessarily looking for the best cost. Last question, back to our health plans for a second. We were talking about health savings accounts to save money on our out-of-pocket expenses. There are also flexible spending accounts, which allow you to park some pre-tax dollars and use them to pay for medical expenses, but you can't do both. So if you have a choice between a health savings account with a high deductible plan and a flexible spending account, where do you suggest that somebody look to make that decision? How best to make that decision?
Right. So both an FSA and an HSA will allow you to pay for out-of-pocket healthcare costs pre-tax. So they're both good vehicles for that. There are a few key differences that people need to think through if they're trying to choose between an FSA and an HSA. One is that the FSA belongs to your employer. The HSA belongs to you. So if you leave your employment, you can bring your HSA with you. However, on the sort of negative side for HSAs, you have to enroll in a high deductible health plan, whereas an FSA, you can have that whether you're in a high or a low deductible plan. But the third key difference, which would sort of tilt the scales more towards the HSA, is that the money that you or your employer put into the HSA can roll into the next year, whereas the FSA is use or lose. So if you don't spend everything in your FSA by the end of the plan year, you've lost that money.
Okay. All right. It's actually a good rubric to use to try to figure out if I don't have a high deductible health plan, then the FSA is definitely the clear choice. But you'd want to look back at perhaps last year's healthcare spending and the year before to get some sense of an average of what you're likely to spend so that you don't over contribute to the
Right.
account and lose the money. Because even though some employers will then let you roll it into March, that's by no means a given. Your center is called the Center on Health Insurance Reforms. What reforms are you looking for as we head into the election season, as we head into the next year? What are the things that you most want to see?
Well, what we're really focused on here, we study health insurance and how it works and in many cases doesn't work for people. And what I see over and over again and talking to consumers and talking to providers and talking to health plans is problems with costs and affordability. That is the number one issue that people are facing. And here in the US, we have the highest healthcare costs in the world. In fact, among developed countries, including high-income countries like us, we spend twice per person on healthcare than any other country. And at the same time, we have much poorer healthcare outcomes. We have higher maternal mortality. We have higher incidences of preventable disease. We have higher rates of depression and suicide. And so we're just not getting good value for the money that we're spending. So that is really where we are focused in trying to research and support policies that just bring better value out of our healthcare system.
Sabrina Corlette will be looking for those reforms coming down the pike and hoping that we get them sooner rather than later. Thank you for this discussion. Thank you for all of the helpful tips.
Thank you for having me.